Hello, everybody. I'm Mark Zusman, the editor of Willamette Week, for another version of Distant Voices. Absolutely thrilled to be here with it's Dr. Dawn Nolt, but I want to make sure I get your title right. Are you the Chief Medical Director for Infectious Diseases at OHSU's Doernbecher? Did I come close?
Not quite, not quite. Thank you so much for having me, Mark. I am an active member in the Pediatric Infectious Diseases division at Doernbecher Children's Hospital. I'm also the medical director for the Infection Prevention and Control department at our hospital. And we're mainly interested in protecting patients and visitors from any infections that would be acquired within our healthcare system. So that's one of my leadership roles.
Well, we're thrilled to have you here, particularly given that here we are in July. Everyone, whether they have school-age children or not, is thinking about the need to get our kids back to school, in part to help the economy get cranked up, but at the same time is very concerned about public health. So let's start with just some very basic education. From the early beginnings of this pandemic, we, lay people, were being told that it appeared that children suffer from bad symptoms of COVID far less often than adults, correct?
I would agree with that assessment that you put out there. Yes, I mean, many questions still remain, but it seems that SARS-CoV-2 behaves differently in children than other common viruses. Children are less likely to show that they are infected and are ill, and they're less likely to have these severe diseases that we are hearing about in adults, such as respiratory failure and having to be on a breathing tube. So it appears that SARS-CoV-2 looks different in children than adults.
So what I am unclear about is, so children are less likely both to show symptoms and get seriously ill.
That is correct.
Are they less likely to get infected?
Well, that's a little hard. I think we often felt that way early in the pandemic. We felt that children were usually not the first to show illness within a household, that it was usually we found the child ill when we were investigating a family cluster. But we still want to keep an open mind and show that maybe children do have some part in transmitting virus in the community, but it's not like we're seeing with influenza, in which it's clear that children are amplifying the virus in the community. It doesn't appear that they have that particular role in SARS-CoV-2 in the community.
It would seem to me that that's a fairly critical answer, or rather a fairly critical question that the medical establishment would want to answer. I was under the impression that there was an emerging body of medical consensus that almost never, if a family has COVID, do they find that it's been introduced to the family by the youngest member of that family.
That is the prevailing, you are correct, but that is the prevailing view. As we know that things change as a pandemic continues to evolve. So it's unclear if that particular principles would still hold as we go into respiratory season, as we see interactions perhaps with SARS-CoV-2 and other respiratory viruses. But you are right, the prevailing view appears to be that children are usually not the first signal in a cluster.
And by children, what age does the research show that, what ages are we talking about? I've heard 12 and 14.
Yes, it depends on how you defined that age range. Most pediatricians would say up to age 21. We are thinking that adolescents may be more similar to adults. So I'd probably say 12 years is a good cutoff, an upper age cutoff.
Okay, so I'm waving my wand and I'm making you the Secretary of Education, cabinet level position. And my question is, what should this country's policy be, given what we know today on the middle of July? If we have to make a decision in the next week, how, if, and in what capacity should we be returning to schools?
So I support the American Academy of Pediatrics guidance for school entry. I am a member, so I have to say that. But I do feel that we, as a organization, the American Academy of Pediatrics, comes in with the perspective of enhancing the physical and mental and social development of children. And we know that's very important in schools. So the guidance, and also this is my belief as well, both as a physician, as a parent, as a community leader, is that we really should start off with kids being in school. Now, understanding that other factors play in. If there's a lot of transmission in the community, if a school's resources are not able to allow for physical distancing or staggering of certain shifts and things like that, then we have to make accommodations. But Mark, I really do feel that we have to start somewhere, and I really think it's important that we understand that being in schools physically is for the child's benefit.
For their health benefit as well.
For their health, that's correct. We do understand that there's impact on teachers, on parents, but the goal of the American Academy of Pediatric Guidance was really from the perspective of enhancing the health of kids and to get them back into school.
So short of testing every student every day or every 2 days, which I gather is not in the cards, at least not this year, what are the kinds of precautions that you think schools should be taking? And should those precautions be increased once a child is 12 to 14 or at that age level where maybe they're just as, they can transmit the disease as well as anyone else?
So I think that interventions are geared towards the age level of the child. So in very young children, it may be a little hard for them to all wear masks or to understand really the importance of washing your hands or using hand sanitizer every time they touch. So this would be an opportunity perhaps to cluster the kids so they don't move between age groups. Maybe having a way in which we could have a lot of classes outside. So those are certain things we can do with very young children. Mark, as we move up into age groups, that's where you may have a little more opportunity to put in more interventions. This is where you can have the school-age kids or the adolescents wear masks, carry around their hand sanitizer, maybe stay in class and then have the teachers rotate. There's all sorts of things that can happen. We understand that there's no one magic intervention that's going to decrease risk of COVID-19 in the schools, but there are a number of measures that we can stagger that would try to reduce that risk within a school environment.
Based on what you're hearing so far, do you get a sense that public schools in Oregon are coming at this in a way that would satisfy you as a pediatric specialist? And I don't know if you're a parent.
I am a parent. So schools are really having a lot of deep conversations about what this means. They're having conversations with community leaders, with parents, and with the teachers, so importantly, about what this education looks like. Do we allow everyone in the schools? Do we give the option to families to have some education at home and some education in schools? So I think Oregon is really doing a very nice job trying to understand the options. We are lucky, as you know, Mark, because overall, compared to the rest of the country, our community transmission is low. So I think we do have a bit of luxury in considering that our kids can go to school and be in school physically.
How do you feel about school organized athletics?
Well, my family's not physically gifted, so that's probably not as relevant personally. But in terms of organized sports, it's sort of developing that social pod, that social bubble. If the team is together and they're really just practicing a lot and not having people introduced into that bubble, it could be safe. The idea of testing on a regular basis can be fraught with giving a false sense of security, right? Because just because you're tested and negative today doesn't mean that you won't be infected tomorrow. just because you are positive now doesn't mean that you're going to necessarily transmit. So I think organized sports does play a role in physical development and mental health issues with kids. I don't think is as important as really putting those kids in school. So in terms of efforts to try to mitigate risk, I probably would still focus on schools more than I would on organized sports.
And doctor, the indoor versus outdoor, again, based on what as a layperson I hear and read, I got a sense that if you could do everything outdoors,
Mhm.
not that you wouldn't have to worry, but that's the most significant thing you can do if you're not going to socially distance, is to try
Mhm.
to be
Mhm.
outdoors. Is that?
It sort of gets that principle of dilution is the solution, right? And so the idea that we are exchanging droplets, or maybe the idea that we have some airborne transmission, that can dissipate once you're in the outdoor environment. And so there has been a lot of interest in having activities move outside. I'll say that recently, when the Oregon legislature had their special session a few weeks ago, I was invited up there along with other ID experts, and we actually proposed the idea that perhaps some sessions be outside. There was a small consideration, and then they couldn't do it. But again, the idea of dilution is a solution. I think it's a very nice option to try to have activities outdoors if you can move it outside.
So, doctor, on a personal level, an acquaintance of yours who's not a doctor calls you up and says, what do I do? Should I believe the Portland public school system? I've got a 7th grader and a 9th grader. They're going crazy. I want to send them back to school. They're planning on having them come back to school Tuesday and Thursday with half classes. What should I do? What do you tell them?
I tell them that there's always risk, that we as pediatricians have always seen this situation in which a child has never seen a virus before and they get sick. That situation is just amplified on a global scale with COVID-19. So as pediatricians, we see this all the time. COVID-19 is a manifestation of a respiratory virus. We know how to deal with respiratory viruses. So all the things that you as a good parent taught your kids, cover your cough, wash your hands, stay away from people if you're sick or other people are sick, those are principles that we can apply anywhere. So if you're able to go back to school, and again, I support going back to school, I think there are measures you can take. And so send your kids to school if you can.
Dr. Nolt, you have been a student of infectious diseases.
Yes.
So on one hand, this is not your first rodeo, but I'm just wondering if you can provide any context for us about how, from the point of view of someone who's dedicated much of your adult to studying infectious diseases and how they work in the organism, what's different, unique, scary, less scary about this one?
I think every pandemic allows us the opportunity to see what we're doing correctly and what we could improve on. This pandemic has been very interesting, and that's really highlighted a number of things, such as the need for personal protective equipment, the need for physical distancing, the idea that an epidemic and a pandemic can travel very quickly and have different manifestations depending on what the population does. So I think this pandemic, just because of its global scale, has really lifted a lot of those, shall we say, weaknesses of our system up. It's certainly, I think, more than many previous pandemics, has really highlighted the disenfranchisement of many groups in terms of their access to medical care and their outcomes. So I think that's probably where I would see this difference in this particular COVID-19 epidemic compared to maybe H1N1 or even Ebola in the decades prior.
And are you of the belief that a vaccine is a year away?
I tell you, Mark, we are making progress in vaccines much quicker than we would have done even a decade ago. I give lectures on vaccinations, and I used to say that if a vaccine got together in 10 years, that would be great. The last Ebola vaccine came together in 5 years. And Mark, I am optimistic. There's a lot of resources, a lot of money, and a lot of great minds towards vaccines. So I am very optimistic that we're going to have something. What is a year from now? Midsummer of next year, I think we would have a good supply.
Dr. Nolt, thank you so much for joining us.
Thank you so much. I appreciate the time to talk with you.
Really appreciate it.